Welcome to the Asheville View. I'm your host, Aisha Adams, and today we're going to be talking a little bit more about COVID. I think it's super important that we keep looking at COVID, keep thinking about COVID, and figuring out how we keep moving forward in our everyday lives. And so today I have some special guests here with me. Please tell our viewers who you are and your involvement with providing COVID-19 information, particularly to Black and Brown communities.
Thanks, Aisha. It's great to be with you all today. I'm Kimberly Alexander. I'm the principal and co-founder of the Alexander Group, a public health consulting firm in Durham, North Carolina. And today I'm representing the North Carolina SEAL team. I have served as community co-lead of the African American and Black community response team. And we'll talk about what all that means in a little bit, but it's great to be with you all today.
Hi, I'm Joseph Fox, and I worked with the MLK Association of Asheville and Buncombe County through our community outreach providing empowerment or COPE program. And health issues are one of the issues that we address through our year-round programming in the COPE program. I serve on the SEAL team as a community response team members, working with individuals and partnering with individuals in our community, such as ABEFPA, Asheville Buncombe Institute for Parity Achievement, and other organizations. So I'm delighted to be with you today.
Always great to have you. Zinzai.
Hello, I'm Zinzai Muyengwa. I like to describe myself as a public health advocate and global health advocate as well. Really interested in helping marginalized communities and underserved populations get the resources that we know are available to them, but they don't always have access to. And so I am the project manager for NC CEAL, and we'll tell you more about that in a few minutes. But nice to meet you all and glad to be here.
So many people are like, we'll tell you about that in a few minutes. Exactly. We've heard so many interesting terms, NC CEAL team, I team, community response. Take a moment and for our viewers and shed a little light on what each of these terms actually mean and how they work together.
Sure, we'll give you some background so we can see a little bit. This might help. Okay, and Zinzai and Dr. Fox, feel free to jump in, but we wanted you all to see the whole organization. So SEAL is a project funded by the National Institutes of Health, and it is the Community Engagement Research Alliance against COVID-19, focused on disproportionately affected communities. The SEAL project started out with 11 state teams, and I believe, Zinzai, correct me if I'm wrong, but I believe we're up to 21 now. Is that correct? States?
You got it.
And so in North Carolina, our specific team in North Carolina named ourselves Increasing Trustworthiness Through Engaged Action and Mobilization. And so the North Carolina part of the national SEAL team is the NCI team. And that group is a partnership between Community Campus Partnerships for Health, the UNC Center for Health Equity Research, and at Wake Forest School of Medicine, the Maya Angelou Center for Health Equity. And we are representing, Dr. Fox and I, and Zinzai are representing the community response team. And so I served as community co-lead along with an academic co-lead, Dr. Stephanie Baker, that's based at Elon. And Dr. Fox was one of our amazing community response team members. So hopefully SEAL as a national partner, I-team is the North Carolina team, and then our group specifically for community members was the community response team.
Oh, that's nice. We had Dr. Baker on the Asheville View right at the height of COVID. So glad to be meeting with you and to just learn more from you. And these names are interesting. I love like increasing trustworthiness because we know when it comes to health equity, that trustworthiness is something that definitely needs to be increased.
Oh, just gonna add a caveat to say we always refer to our team as NC CEAL, just to denote the fact that it's the North Carolina version of the SEAL Community Engagement Research Alliance against COVID. And so we're just like the North Carolina version of the general SEAL program.
And I would say just locally, when I'm talking to people, I really try to emphasize the community response team portion of it, so that they know that we have a national level, we have a state level, and then in our local communities, we are really out there, boots on the ground, trying to get reliable information to our members, to making sure we're getting testing, making sure that we are dispelling myths around COVID-19, as well as making sure individuals have protective gear that they need in their daily life.
Speaking of myths surrounded by COVID, I know each of you, because this is your daily work, you're encountering a lot of myths. If you had one message that you could get out to our viewers who are particularly Black and Brown people, they might be elderly, they might be a part of just one of those heavy affected populations, what would that message be?
I would say that the vaccines are safe and proven, and that if individuals thought about it and think back at the beginning of the pandemic, where wealthy folks were trying to buy their way to the front of the line when the vaccine first came out, if anything, that should tell us that they are safe and reliable, and we should be getting the vaccination.
I think something that I've heard time and time again from folks is that they're concerned that there is an agenda to harm Black and Brown folks with vaccines somehow, because, and this is based on the fact that we have a long history of both the government and others actually abusing our communities. And so I think one thing that I would share with folks is just that this vaccine was actually part and parcel of Black physicians, clinicians, and researchers were part of making this vaccine. And so that's one reason why that they can trust that it's safe and healthy for them to take.
My point rounds it out well, that the pandemic is not over. And so we need to still be safe and wear our masks indoors. My children are in school where it's not required, but are still wearing masks. And that we want to protect both ourselves, our community, and the people around us. And so just to remind people that it's not over, there's things that are changing. We've come out of quarantine and those deep, everyone sort of requirements, but we still need to be able to keep ourselves safe. And so it's important to know that it's not over yet.
So still washing our hands for that minute, still wearing our masks, still making sure that we are kind of keeping our distance in public and that we're not going back to the way that we were before. So thank you all so much for that. I know it's a lot of misinformation out there. And I know firsthand, because y'all know I'm originally from Birmingham, Alabama. So I know firsthand about like the distrust that we have sometimes for the medical system, and it can be hard, but it is comforting to know that like it was an inclusive effort that got us here. And I think it's important for us to continue to keep ourselves safe. Why do you think the messaging about COVID-19 has been such a difficult issue for Black and Brown communities?
I'll jump in and piggyback off of what you just said about being from Birmingham. So there is still distrust in Black and Brown and poor communities around medical treatments. The disparities just in general around medical treatments are still there. And so when you're looking at the messaging, and particularly in our early days of the pandemic, when the message kept changing, that was one of those items where people that are already skeptical and doubtful are saying, well, see, look, they can't even get on the same page with the messaging. And I think as we look at that, we tend to be somewhat distrustful because of our past experiences and our learned experiences. And so that one of the things that we've tried to do as a group is to really focus in on what is our messaging and how do we reach people that need that messaging. And one of the things I say is, if you don't want to do it for yourself, do it for other people. Do it for the people that are around you that are compromised. And so, I have older sister that's retired major from the Air Force that has a compromised respiratory system from being in Desert Storm. My dad is 94. And so even if I personally didn't believe in the vaccine and the masking, I would have already masked for them. And so do it. If you don't do it for yourself, do it for others.
I think Dr. Fox is a great example of the leaders that were part of our community response team from all across the state. And so we made a specific effort to be able to share some of the information that we were hearing in our communities, and then be able, with our partnership with the University of North Carolina, being able to use those partners to be able to answer with trusted scientific information. And I think Dr. Fox made a great point that because COVID was something new, information was changing. And so it was really helpful to have the alliance, the SEAL Alliance, to be able to have trusted information from individuals who continued to show us why information was changing, what new things were coming available, so we could share the most up-to-date information.
And I would say we weren't good about it, particularly in the early days, putting it in layman terms.
Right.
Yeah.
You know, we had medical doctors and scientists, researchers sharing the message. And so they were talking to us like we were, their peers in the scientific arena. And so, one of the things we've tried to say is, how do we put the messaging in layman terms where people can understand the importance of protecting themselves?
I think for me, like my biggest takeaway from all of this too, is just you got to develop you some trusted relationships within the medical community. And maybe like our next step through the Asheville View is like really talking about how do you find a doctor that you can trust, medical professional that you can build relationship with, because you got to have somebody to talk through these ideas as these things are changing, because we're dealing with problems that we aren't used to dealing with. So I think a big part of that is I knew that Dr. Fox works on the SEAL team. I work with the doctors at Mayhew. I'm like, did you get your shot? And like, so those are some things that we need to take some kind of personal responsibility for our health and start to build out that health network, right? Because that's where that equity is going to come in. So this is such a great conversation. I just want to know if you all are familiar with long COVID, because I keep hearing that. I'm not really sure what it is. Can you tell me what it means? And like, should I be concerned? Because I've never had COVID. I've had my shot. I had a couple of boosters. Like, should I be worried?
I can give you just a quick overview of what long COVID is. Some people are referring to it as long haul COVID. Some people are referring to it as post-COVID. And really, it's just a term that describes the fact that some people that have had COVID are experiencing some of those symptoms way after testing positive. So usually it's after 6 months, they're still experiencing some of these symptoms. So some people have not gotten their sense of smell, taste back. They're still experiencing that brain fog. They're still experiencing fatigue and things like that. And I think just based off what you said, even, there's really not a lot of information out there. And in fact, like doctors are still trying to figure out how best to diagnose, how best to treat and support folks that are experiencing this. And I think something that I was going to mention earlier when you were talking through, I guess, some of the mixed messaging that came out is that people forget that science is something that's iterative and it's something that's continuous. And so this is something that we're still learning about. And that's why when we are hearing mixed messaging or we're hearing things changing time and time again, it's because the science is changing. People are learning new things about said issues. And so I'd say long COVID is something that we're still learning more about, but we have determined some things about it, which includes the fact that people are still experiencing those symptoms.
What I tell people is that it's like the flu. It changes every year, and so again, trying to put it in layman terms, we never know with each strain of the flu how it's going to impact us that year. and it keeps changing. And as it changes, that's very similar to the COVID variances as they are mutating.
Right.
And so as that occurs, just because last year you had the flu and it didn't really impact you, doesn't mean that the next year it's not going to just knock you on your back, flat on your back. And so when we're talking about COVID and particularly reinfection, just because you've had it does not mean that the next time that if you get it again, that it will not be more severe than before. And so when you talk about long haul COVID, we never know at this point with the data how the cumulative effects are going to impact your organs in the long term. We're not there yet. We're not long term.
Got you. So I don't want to waste, your time. I know you're busy fighting COVID and getting us, all the information we need, but, I love games. So I was hoping we could play a little bit of a game, right? So I have these statements, and the way this will work is each one of you, it's like y'all, me against y'all. I'm the non-believer. And you are going to demystify some of this information for me. So I'm going to read out a statement, and then each of you will pick a statement to rebuttal. You'll have a one sentence statement rebuttal. Y'all ready? So my first one is, I don't need to wear a mask because I've already had COVID-19.
I'll start. The mask protects not just you, but other people. And so you want to wear a mask to make sure that you're protecting yourself and other people around you.
Not only that, but since even though you did get COVID, you actually can get it again because of the fact that the virus does mutate.
And we know that COVID is transmitted through the aerosol. So therefore, protecting yourself with the mask is your best protection in conjunction with the vaccine.
Well, I heard they rushed the production of the vaccine and that it's not safe.
The vaccine and the way the virus worked has been research that's been done 10 years ago about the way this vaccine is administered. So they were able to build on information that was already available and make some changes based on the COVID virus.
Along with that, something I always like to tell folks is that what happened with the vaccine is that they brought on all hands on deck. That means all the scientists, all the researchers, all the clinicians, all the folks that are working in research. And it's like if you were building a house. If I had a house and I built it by myself, it would take me a long time. But if I brought on all the folks, all the experts to build that house, it would happen in a shorter time period. So that doesn't really impact how good the vaccine is.
Let me just say that the COVID-19 virus is a coronavirus. And so as you think about the family of corona, we've had coronaviruses for a long time that they have been studying. And so if you think back a few years when SARS and SARS-2 was hitting our communities, that's part of the corona family. And so the research that was done even back then.
Well, I'm not a high risk category, so I don't need to get the COVID-19 vaccine.
We don't know how each person is going to respond. Those that are high risk may have different ways that the COVID virus infects their bodies. But it's important for everyone to get the vaccine because there may be side effects based on your unique body chemistry and history that you weren't thinking about that haven't been explained yet as the possibilities of what could happen from getting COVID, contracting COVID.
And I would add, even though you might not be at risk, there might be people around you that are at risk. So you might want to get vaccinated just to keep them safe.
If you're breathing, you're at risk.
Well, COVID-19 doesn't really impact Black and brown people like it does white people. So I'm good. I'm melanated.
That is something that people thought at the beginning of the virus because more white people were affected. But as COVID has gone on, we've seen that Black and Brown communities who already suffer from different outcomes and usually poorer outcomes have been having worse results and worse, what's the word I'm looking for? Outcomes and symptoms around COVID. And so it's important to understand that while things looked one way at the beginning, when there was a little bit of information available, there's a lot more available now, and a lot more people in Black and Brown communities are being affected.
My last one is, we just need to have faith that God will keep us safe.
I'm a person of faith. I believe that God is a part, that there are scientists who are based their information on the science that they've learned and faith. And so I'm a big believer in science and faith.
I'm a former director of Christian education and formation. At the time, had 32 churches that I did all of their educational information for. And what I tell people is God gave each of us different talents. And he gave the talents to the doctors and the scientists. And so if we have faith in God, we have faith that he's given them the right skills and ability to lead us through this pandemic.
Well, it's such an honor and a pleasure to play the doubting game with you all today. And to just learn more about COVID. I don't want to stop talking about COVID-19. I don't want to push it under a rug, especially because I know that, like you said, Kimberly, so many Black and Brown people are experiencing discouraging outcomes because of the virus. So we have to keep talking about it. We have to keep getting educated. We have to keep sharing resources. So I just want to thank y'all for being on the Asheville View, and I'll see you next time.
Thanks for having us.